The name of the project tells it all: Partners Investing in Nursing's Future.
I went to the president, Dr. Steven Schroeder, and I said, there is a nursing shortage coming. And shouldn't the foundation, with its mission of improving the health and healthcare for all Americans, shouldn't the foundation be involved in having nurses get involved with that mission firsthand?
It really was an initiative to have local foundations and regional foundations and other people who had not been involved in supporting nursing in the past to join with the Robert Wood Johnson Foundation and Northwest Health Foundation in working together.
And our view was that if we could engage the local and regional funders as a real partner in the effort, that we might be able to continue the funding locally and regionally when the big grant was finished.
Those relationships that we're able to build with other funders, and which we're continuing to do even as we speak, are going to pay benefits and dividends down the road for nurses, nursing, and of course, patients and consumers.
I would say that the program was a godsend, that I would not be working in nursing today without this program.
We called Michigan State to see if they would be interested in partnering with us. And they had an idea that extended their idea of the Nursing for Life program into helping nurses transition into areas other than the acute care hospital.
Michigan State is a land-grant university, so outreach is a component of our mission, and that means working with nurses throughout the state and other healthcare providers on a whole variety of different issues.
Most of my career was spent working in pediatrics. To try to go from pediatrics to adults there's a gap between those two areas. And then the second part of what the refresher helped me with was going from working in a hospital where I had spent my entire career, going to a community-based practice. I was able to just log on anytime I wanted to, and that was very flexible, very convenient.
You have to show that there's a need. And in this case, the need was your local community needs nurses. And we presented the list of priorities to interested funders who then got involved in funding nurses.
The Tufts Health Plan Foundation really saw its role not only as the lead foundation on the ground, but as a catalyst to get others involved.
There's both the infrastructure and the resources. So if you're in an academic medical center where you have your School of Nursing and your School of Medicine in the same building, that's the Massachusetts model.
Philosophically, the campus has a strong commitment to team-based learning, and really a commitment to the foundation of patient safety and patient quality begins with that interprofessional experience.
In Rhode Island, you have geographically separated schools coming together, forming an infrastructure themselves with now a formal MOU between the schools and a formalized interprofessional curriculum.
Brown feels like it has an incredible responsibility to the population of Rhode Island. And our associate dean at the time committed Brown Resources, and it didn't take much convincing because he understood the need for a project like this to be put in place and then to be sustainable going forward.
We have been very successful at finally getting people to really work together all the time. That is, come to meetings, plan the curriculum, have real focused objectives, work toward goals, and make something happen.
The success of PIN really is around the relationships more than anything else, and the people that I talk to who have been at the project sites, they talk about, you know, the next project and the next project that they're going to do together. And that was always my hope, was that we would create a relationship that would be long-standing.
If we really want to change healthcare outcomes, if we really want to improve health, the way we're going to do that is really by truly partnering with the community and supporting them in the efforts that they want to undertake. And in this case, it was nursing, and it has had a profound impact.
And I will tell you that the strongest state action coalitions had a strong PIN partnership at their core. And you could just tell the leaders were there, the infrastructure was there, and it was really exciting. So this legacy, this PIN legacy, is completely living on through our campaign, and it is extraordinary.